So, 0 healthy individuals under the age of 50 have died of COVID-19 in Israel, according to newly released data. 0 deceased of 18 to 49 years of age with no underlying morbidities, the Israeli Minister of Health, MOH, said in a response to a formal request from an attorney. So there was a Freedom of Information request, and they wanted to get the data on that. And the Ministry of Health said that there were 0 people deceased between the ages of 18 and 49 from COVID who didn't have underlying morbidities.
Oh, you don't say.
That's what they say. Okay, but there's more to this. That's not the end. Officials noted that the statement only applies to COVID-19 deaths where the Ministry of Health conducted an epidemiological investigation and had received information about the underlying diseases. So that doesn't mean all people between 18 and 49 who died. That just means the ones that the Ministry of Health conducted an investigation on and had received information about. What? So I thought the Ministry of Health had all this unbelievable amounts of information, but now they're saying we don't really have that much. But the writer in this article says 0 is very, very clear number and cannot be subject to interpretation. Zoev Yehekzekli, a specialist in internal medicine and medical management and former lecturer in the Department of Emergency and Disaster Management at the Tel Aviv University in Israel, told the Epoch Times. So this guy says 0, it's pretty clear what's happening. Why? So if there was 0 deaths, why were all the extreme measures of school closures, vaccination of children, and lockdowns needed? That guy added. The Ministry of Health did respond to requests for comment.
They did?
Says they did.
What?
The information was sparked by a Freedom of Information request filed by attorney Ori Zabi, it's a great name, who has been filing several such requests as he seeks to obtain information from the Ministry of Health regarding the COVID-19 pandemic and the COVID-19 policies. Zabi asked to know the average age of people who died of COVID-19, segmented by vaccination status at the time of death. So he wanted to know what's the average age of people who die from COVID-19 and were they vaxxed or unvaxxed at the time of dying. And then he wanted to know how many COVID-19 patients with no underlying morbidities under the age of 50 had died. And the annual number of cardiac arrests cases between 2018 and 2022. So those are the Freedom of Information questions he asked. And the one about how many COVID-19 patients with no underlying morbidities under the age of 50 died, 0, according to the Ministry of Health, 0. But they qualify that by saying we don't have all the data, we just have certain amounts of data. The ministry's intelligence system has data on gender, age, district of residence, and the underlying diseases of the deceased, according to that document. The system showed that about 94% of the deceased were 60 years or older, and that there were no deceased with 0 underlying. So even over 60, you had to have a comorbidity to die. Like, remember Joe Rogan broke that on? Well, I first heard about it from Joe Rogan when he said, yeah, when people die, they have 3 comorbidities. The average of people who die.
What is he, a horse?
In addition, on May 4th, 2020, the medical directorate of the Ministry of Health, in a letter, issued instructions to the heads of the hospitals and medical departments of the health maintenance organizations, national healthcare organizations, on how to fill out COVID-19 death notices, directing them to include underlying diseases. And in December 22nd of 2020 letter, the medical directorate to the managers of the hospital stated that for every COVID-19 patient who died during the acute phase or due to complications of the illness later, or people who were positive for COVID-19 who died, a death notice and a summary of the case must be sent to the COVID war room of the Ministry of Health. They said that the purpose was to improve surveillance. So they've been telling us over and over and over that they've got the data. And then as soon as someone wanted to get the data, they're like, we don't got that data.
I can't believe they were more forthcoming than, here. They were like, they even gave that data.
Well, so studies and other data, including a study led by Stanford epidemiologist John Ioannidis, I can't say his name, showed that the COVID-19 mortality, even with the original variant, was largely age dependent. It was definitely a disease that actually only endangered the elderly. Over the age of 60, mortality doubled every 5 years, while under that age, mortality was negligible. And now we really see that it was zero under the age of 50 at least. So if you didn't have a comorbidity and you got COVID and you were under 50, you didn't die. That's what they're saying. Well, here's that study. The COVID infectious fatality rate in 2020, remember, that's the most virulent strain of COVID-19. The death rate was 0.1% if you were under 70.
So not some comorbidities. That's just being under 70.
That's just being under 70.
But it's 20 times higher than the 0.001%.
There may not have been many young people who got seriously ill, yet the Ministry of Health had emphasized cases of pregnant women hospitalized in critical condition and young healthy people who died because of COVID-19. It was not the true situation, he said. They created a false presentation of the very severe epidemic that affects the entire population, and therefore the entire population should also be vaccinated regardless of age.
Oh, well, at least they had something good in mind.
So
a noble cause.
So no, he's saying they created a false presentation.
No, that's the thing. We have to scare them.
Yeah, and Dr. Drew, when I was on his show, revealed that he worked with Dr. Fauci during the AIDS crisis, and Dr. Fauci's number one way to deal with the crisis is to scare people.
You got to scare them and tell them.
And that's what he did. He used fear, preached fear, and that's what masks were about. It was about creating a psychological state of fear.
Don't hug anyone with AIDS.
And so they made the virus seem way more deadly than it actually is. They scared the hell. I thought if I got it, I was going to die. Everybody thought they were going to die if they got COVID.
I got vaccinated immediately when it was available to me.
That's right.
I wasn't one of these nerds who were like, I think I can get in early. People that got they faked I work in the service industry, I have to get it. Some people, I didn't do that, but I got it right away.
I got it.
Because I thought we wouldn't have to wear a mask.
They said you could
put them back on.
Yeah, you're going to go, because if you get it, you're not going to, they told me I wasn't going to get the thing. I wasn't going to contract it. I wasn't going to give it to other people. Yeah. And I could go back to my regular life. That's what I was told.
How long
that was
did we have
always a
off?
lie.
How long was that?
What do you mean?
You were allowed to take your mask off for 1 week. Remember that?
Yeah.
That's how well it worked.
So the point of this is they're saying that they made this all out to be way worse than it actually was, so they could sell you stuff. And that kind of is that's the truth. That's actually justification given for vaccinating pregnant women, young people, and children was that they too are affected by COVID-19. We showed you that children have a greater risk of dying from the flu than they ever did from COVID-19. It was known back then that this was not the case, and we now see it clearly, asserting that the Ministry of Health has lost the public's trust by making a false presentation of the dangers of COVID-19. That's happened here too. That's happened all around the place. Everybody keeps talking about this crisis in public health. Nobody trusts their public health institutions anymore. And that's not because of YouTubers like Jimmy Dore or Joe Rogan. That's because they lied repeatedly over and over and over and over and over about the risks of COVID, about the vaccine, about masks, about immunity, natural, herd. They lied about everything.
You're not going to get COVID if you have these vaccinations.
The vaccine can stop the spread of these diseases.
No excuse for anyone being unvaccinated. This continues to be a pandemic of the unvaccinated.
This is really becoming a pandemic of the unvaccinated, and that means getting vaccinated, you can save yourself.
These vaccines are highly, highly effective. And when people are vaccinated, they can feel safe that they are not going to get infected.
Fully vaccinated people are at a very, very low risk of getting COVID-19.
Our data from the CDC today suggests, that vaccinated people do not carry the virus, don't get sick, and that it's not just in the clinical trials, but it's also in real-world data.
What's your take on the next steps for COVID? What should the country be doing right now?
Getting vaccinated.
And for those who aren't?
They've got a problem. We have the capacity to control it. They should get vaccinated.
Let me emphasize that if you are vaccinated, you have a very high degree of protection, and therefore you do not need to wear a mask.
This is a pandemic of the unvaccinated. The unvaccinated overcrowd our hospitals.
Well, guess what? How about patriotism? How about making sure that you're vaccinated so you do not spread the disease to anybody else?
Person, should we have any worries about walking by someone on the street who may be unvaccinated?
Not at all. I would have no concern walking down the street past a person who's not been vaccinated and even a person who's been infected, because the protection is really quite substantial.
Whether you're working in a supermarket to make sure you have been vaccinated so you're not spreading anything to anyone else, or you're not likely to get the virus.
The primary endpoint upon which the 95% efficacy was determined was based on the prevention of clinically recognizable disease.
Now we know that the vaccines work well enough that the virus stops with every vaccinated person.